Okay, just to say Assalamu alaikum to Dr. Aida Sulaiman from Uganda Islamic University. It's called IUIU, Islamic University in Uganda. She organized a senior staff training program for 4 universities in East Africa.
Assalamu alaikum wa rahmatullahi wa barakatuh, sir.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Ahlan wa sahlan, welcome. Okay, so this application I have from, this is from Uganda, from Kampala. And the project is about, project title is called Bookmaking. And I will also ask everyone who has project, please send your project application here in Zoom, so I can actually download and share here. See, Mr. Nadia, long time. Assalamu alaikum.
Alaikum salam. I'm sorry, I'm late.
Okay, ¿cómo está? Okay. ¿Cómo está, guys? How are you in Filipino language? I learned how to say how are you in 10 languages. So this is one of them.
Wow.
Because just to break the ice. Anyway, this one is about bookmaking in education sector. This is for primary school in Mbale district, where Islamic University in Uganda's headquarters is. And the budget, they have $7,000 and they're asking for $5,000. This is the kind of thing, when you apply for a new funding source, you don't apply for 50,000 because you need to establish confidence and you need to demonstrate competence, meaning you are able to deliver as you promise. So not only on paper that we need to convince the funding body, which should, the project proposal should align itself with the organization that's funding their priorities. And if it is on paper convincing, ask a small sum first round. And then when you demonstrate, when you perform, when you prove that you have delivered what you have promised to the funding body, next time round you can ask for more and they will consider more and they will actually do more. Now, so far, can you all keep your microphone mute, but camera on so we can see each other? Okay, now here on the detailed information, that I have, it says to avail education solutions in bracket study materials to schools in remote areas. This is actually good, but it needs to be defined. Instead of saying education solutions, no need to say education solutions, straight say study materials. To publish or purchase study materials for primary schools, and you can say a number of schools involved that you want to benefit, say 10 primary schools in remote areas from around Mbale. You should say that it is around Mbale, if it is Mbale city, okay? This is talking, then I go to executive summary. I don't, it has given organizational structure, governance, and staffing. That means an organization that is going to fund you. They want to see that the organization is well structured. Its governance arrangements, meaning governance are at 2 levels. One is the policy level, where the board, unpaid board members make policy and budget limit decisions. And then this governance is also at staff level. Who is head of staff? How many staff there? How decisions are made and implemented? So this governance has operational level and policy level. Those are the 2 levels of governance. That means how it is run, who makes decisions, who actually controls the organizational policies and operations. So that's governance. And staffing is how many staff you have, full-time, part-time. Volunteers are unpaid staff. So you can mention that. This is about organization. It also talks about major achievements. Okay, the major achievements, in other words, organization has achieved certain things. Let's say you can say this organization has established and is running 5 schools, 5 primary schools. That's an achievement. We have graduated from primary school over the last 5 years, 500 people, for example. That's an achievement. And if you want to more specify it, you can say so many of the children who graduated or finished primary school from our schools, they have gone into secondary schools. 70% or 80% went to secondary schools, meaning not only they have gained something, but they are worthy of admission at secondary schools. I think there is, okay. Some microphones were not muted, so I just muted it, so there is no noise. Okay, now there is an executive summary. It says abstract of the project. Now, abstract is a descriptive information flow about what this project is trying to do. This is executive summary, means a summary that's pinpointed, executable summary. It says with over 40 million people, Uganda has 70% below 30 years of age. To add to that, the poverty levels have stricken hard this East African country, making access to education difficult as many lack schools' basic requirements from books and many others. To extend a hand to the government efforts, Godong Solutions is the organization, intends to set up a book manufacturing center workshop to help schools going children having access to books and other. Now, the project title here is saying book manufacturing center. You can say book publishing center. Usually book is not used as manufacturing. Book is used for publishing. So the title of the project, it says that to avail education solutions or study materials to all schools in remote areas. So here you can say publishing, primary school book publishing project. Can you see it captures, you want to publish books, which means it will be printed, it will be prepared and printed. You can say to write and publish so many books, so many copies of so many books, let's say 5 subjects, and you can say 2,000 each. So that's 10,000 books on 5 subjects. And say for 15 primary schools in and around Mbale area. Okay, so you need to be more specific. Generally, if you say general statements, it doesn't carry the weight of specifics. So that's why also the project name needs to capture the project heart, meaning what's the project is all about. If I say that this project is about writing and publishing primary school textbooks, then you say writing and publishing primary school textbooks project. That actually captures it. Okay, so this is how it says that we intend to manufacture the books. Materials like computer is manufactured, but books are not manufactured, so don't use manufacturing for books. You say publishing. If you have book manuscript ready, you say book publishing. And for your information, the IIIT's affiliate, Bangladesh Institute of Islamic Thought, BIIT, has published many books. So this is publishing books, okay? We intend to publish, if I can use my word, publish the books locally, and hence all the required machinery shall be stationed at our workshop. So you will have printing machines, two products shall be put in place. First, the free to all schools affected in rural areas, and the subsidized one for those in the middle class in terms of income. Now here you are saying two things. It should be said number one, number two, instead of in a statement. It is easier to write number one. This we intend to publish books and two types of books. One, free for poorest areas, and subsidized cost price for middle class areas. So like that. So it's very clear who have some income to buy the books. This is executive summary. Rationale. Rationale is justification. It is important that we give justification. And here it says background information on the countries and targeted areas. This is what the funding body is looking for. Relevant information on the countries covered. So it's about the background, meaning the country and the socioeconomic status and number of people in poverty, that kind of thing. So the answer given is Uganda is located in East Africa. Over 70% of the population is below 30 years. Now, this is a repetition of what has been said before in the executive summary. So don't repeat it. Background is that part in executive summary you don't need. The background you need here. So you gave in executive summary it's not about the country, it's about the project. Executive summary is about the project, what you want to do. But background starts with the country, a country profile, the target community profile, and some because it's educational project, some educational status of the affected area or target area. So it's so it says, much as the government has tried to promote education, many schools in Uganda still have inadequate aids for school children. Inadequate materials, you can say, especially in rural areas. These includes books, reading tables, and many more. You actually specify, instead of many more means, you identified two, but many more means there are more than two. So you should specify there. Okay, now problem analysis. Core problem is that the project is expected to address and the contents. So instead of core problem that the project is expected, this doesn't mean much. You should say there are many primary school children who are not having any books. Okay, so that means that shows the problem analysis. You say that you can say total primary school population if you know. Then you say how many people are not having any benefit, are not having any benefit of education because there are no books. So you need to specify exactly what is short. So you can say 10,000 primary school children are not having any education because the schools cannot provide them books, and therefore their education is highly limited. Can you see, very specific, pinpointed? So the problem analysis is you can say because 10,000 children are not having the educational need fulfilled because of lack of books, therefore they will not be able to contribute to the economic activities and growth. Instead, there will be liabilities on the society. So instead of contributing, they will be consuming. Can you see? You're making a case out. So it says that the project will provide locally manufactured, again, published school books to the disadvantaged schools in the rural areas. So you need to revise the language. You got the hang of it. Just Main rationale for OPEC fund support. So this is asking 5,000 out of the 7,000. So that means 2,000 is from other sources, local or national or international. So here, contribution to this is sustainable development goals. Anybody knows about sustainable development goals? United Nations agreed SDGs for the whole world. Sustainable development goals, so they have goals that are developmental and that can be sustained. Okay, that's sustainable development goals, I think 17 or 18 of them. So it says that contribution to SDGs, alignment with partner country, and OPEC funds mandate and corporate strategy. Linkages to the OPEC funds country strategy. These are all generalized statements. You should say specific. You see, I have been a funding officer for most of my 35 years career. So this kind of thing is too general. Rationale is OPEC wants this, and this is what we want to do and specify it. OPEC funding objective is this, and we are going to deliver it in this manner. Can you see this is, so here it is too general as a rationale. Rationale, let me give you a specific. Rationale have two components. One component is what benefit will it bring. This is one rationale. OPEC wants to do certain things and you align it with that objective and say we are going to benefit like this in Uganda, so many children in this rural area, okay, involving so many schools, okay. Then you say, what are this is positive justification. There is negative justification, which means if you do not fund, that is the funding body, if there is no funding available, then these are the consequences. These are the adverse effects, because these children will not have education, they will not have books, and therefore they will not be able to benefit from education, and then they will not be educated, and therefore they will not be self-reliant, and therefore they will be dependent on others for survival, never mind progress. So can you see, positive negative justification will give, and it is connected to the funding body's purpose. So this is better, it's written as a paragraph. Last time I said, that was some time ago, that I did the same exercise for this region. I said, and I say it again because the person who has done it, it's first time it seems, you write it 1, 2, 3. Rationale, positive 1, 2, 3, negative 1, 2, like that. So you give justification. Why? Rationale is why are you doing it? Well, what's the point? So you give rationale. Project status here, this section should clearly state. So you said project is still at development stage with financing resources from the proprietor and friends. If it is at development stage, this is too early to apply for funding. Okay. If it is development state, I can see Dr. Anule has sent his application, but you sent it with Dropbox. Let me see while it's cooking. Yes, I've got it, but I cannot share it like this. Let me see if I can download it. Okay, so project is still at development stage, it's saying. Okay, download, yes, I can find download. Okay, it has been downloaded. Okay, so now I can share it. When I'm ready, I will share it. because I'm just dealing with one. Okay. Here, if you are saying project is still at development stage, then it shows to the funding body that you are not ready for funding. You have to have project developed on paper. You have a vision and you convert it into a proposal. Okay, so it says it's the project status is pre-appraisal, appraisal, design stage, ready for implementation. When you are ready, if funding comes, you are ready for implementation, then it's not a development stage. But if it is development stage, that means you don't know which book to publish, you don't know how many, you don't know which schools, you don't know which books, list of books, maths, physics, chemistry, whatever it is, history, social science, or health, and whatever it is. So I'm not sure what this project application is trying to say, development stage with financing resources from the proprietor and friends. So this is actually not a good way to say it, okay? And then the project goal is to avail to less advantaged rural school children. Project goal is to publish and distribute books to children. Simple, make it simple. Project main components, bookmaking. So bookmaking is not clear. Is it book writing or book publishing? So if it is both, write both. Bookmaking is not standard expression. Manufacturing of exercise and reading books. Now here, reading books for schools subject you should give, not manufacturing, publishing, as I said. So it's bookmaking and binding machines. So there is a publishing of books, printing of books, and binding of books. It's all part of printing. There is WBS, work breakdown structure, meaning what are the sequential events that should take place. That's called work breakdown structure. Let's say, if you want to decorate a room with carpet and furniture, you can't bring furniture first and carpet second, and then you do the decoration. There is a sequence. You do the decoration, you put the carpet, then you bring the furniture. Can you see the sequence? One has to depend on other. So you also should say work breakdown structure, meaning what are the steps you're going to take, what work this for this project, break it down. So now here, project input, materials, this tooling machine, paper cutting machine, stitching machine, perforating machine. So it's all about machine. Then human resources, 5 people to manage operations. In general, if it is a one-off, 3 months for some people to be paid to do certain things, they will consider it. If it is ongoing, they will not take responsibility because they don't fund any project on an annual basis. Okay, you need to keep that in mind. It is one-off. So they will pay this year, and next year they will not pay like that. So you have given direct cost 5,000, indirect cost 2,000, total cost 7,000. So you need to give breakdown of details what this 5,000 will do. The money that the funding body will provide, it should give a list of what should be done, like books. I said the numbers. There are more. Let me share what brother has just sent. Brother Yusuf, can you make me host? I thought you made me host. I can't find sharing part. Yes, I have found it. Okay. I can now share it. Yes. Can you see? Is it visible?
Yes, yes, sir.
Okay, good.
We have
Now,
seen.
yes. Now you can see this is Dr. Anuli Omar. He has prepared. Organization name is Swaiha Charity Foundation. This is good. You have given the organization name, then data service. These are about organization. I will not spend much time on this. Information on the organization about objective. It is also specific. Organizational structure is nicely given. This is quite well done, brother Anuli. Major achievements. We achieved legal status. That means it's a registered organization by a government body, and that requires certain status of performance and structure, governing documents, qualified people, all these. So now here, let me say, we have achieved legal status, it's okay. That means you should say when, in the year there, that would complete it. We conducted a successful Ramadan iftar program for needy communities in the years to 2021, 2022. Here, you only talked about program achievement is how many people benefited. It's missing here. So needy communities, but how many people actually benefited will give the scale of your contribution. So here you need to give numbers of people who benefited in 21 and in 22. So otherwise, if we conducted means it can be just 5 people instead of 50 or 500. So you need to give, you have to think in terms of the donor mindset. Okay. We have conducted Eid al-Adha sacrifice program for the last 2 years, sharing with dearest of our communities. Again, the number is missing. You need to say how many people are beneficiaries. You can also add how many people volunteered to benefit the needy people. That means you can say that we mobilized 25 volunteers to help 250 people. So you can see that the image it is giving is how many people you can mobilize to volunteer for helping others. So that gives the organizational strength and the organizational reach in terms of mobilizing the helpers, okay, and how many people having been helped. So you need to give numbers. If you have that kind of background, you can say out of the 25 volunteers, 5 are professionals. You can say 5 are senior professionals, 5 are reputable professionals. That means they have some social status, economic status, academic status, professional status. So this kind of thing. We have conducted over 40 medical outreaches. Now that's a good number. This is a good number in remote areas and impacted more than 10,000 people. This is the kind of thing I was been talking about. So please, you make a note what I'm saying so that you can actually, when you prepare the project and submit to Vienna, this is actually Opec Fund for International Development. Opec is Organization of Petroleum Exporting Countries, and you know that Saudi is the most powerful of these OPEC members. Gulf countries primarily, and Saudi being the biggest. Russia is a big exporter, but Russia is not a member of OPEC. But OPEC deals with Russia so that they can control the oil market. So here, the last one is we have been able to mobilize 30,000. Now that's another good image. But you have not said how many years. Is it 1 year 30,000 or 5 years 30,000? So that's the missing information. So the donor wants to see the capacity of this organization in terms of achievement. So it's 30,000 is big if it is mobilized, let's say within a maximum of 5 years. Now, next part is contact details, funding sources. This is good where you got funding from 10,000, for the last 2 years. That means 5,000 each, 9,000 in 12 months, and 15,000 over 2 years. Now, this is the summary. If you had given in 30,000 that over the last 2 years, then it would give a lot of impact as the funding body goes through the application. So here you have given breakdown and you have given the number of years or months. This is good. Okay. Executive summary should not give background. Uganda is a less developed country. It should come under background and main rationale for the. So this is where you give about the country. Executive summary. Hold on. Okay. So executive summary is, it says 1 page maximum is project summary, not the country summary. Can you see the disconnect between this? So please note that you don't say anything about the country profile or country situation. That goes into background and main rationale as foundation for the project application. Here is about abstract of the project. What's the core business of the project? Okay, so this is, most of the things seem to be background. Total cost of the mobile van with customization into mobile clinic and facilitation of volunteer team for a period of 12 months with fuel, meal, and accommodation will be 28,000. Okay, so this the amount for the first application is high, if that's the amount you're asking. When you go to the funding body, start small, build confidence, build deliver, build an image of a responsible, competent, committed organization that performs and delivers what it promises. So I would say 10,000 is a good start, but not more than 15,000 for a new organization. So this is almost double that. So my preference would be, if you can stay 10,000 or below, that would be better. First application, okay? So here you have given background. This is good, but what you do is this bullet point is better. And then writing, the next round of writing that how the organization is addressing the challenges. You can also do, instead of narrative, which is just text, you bullet point again. It's easy to read. And here, executive summary, quite a lot you have given, but you can just highlight some. I would say do not, executive summary, most of it is not about the project. It should be about the project. So you remove them. 4.1 is about how many, maybe about 10 points. If you can reduce it, it's better, and highlight the most important catchy things. You can say Uganda, third world country, everybody knows. So you can say how many districts, all these are not really so important. The important thing is how many people and what's the poverty line, what's the educational status, what's the economic status of people, and what you want to do in the target area, what are the socioeconomic conditions of those people that you're trying to benefit. Not the entire country's situation. You start small with the country, but focus on your target population, which is the background and rationale for the project. You see, it says background and main rationale for the project. So all these 111 districts are not really what they want to know. Okay. 1962 has produced record persistent socioeconomic decline. Also, you can say that it has been economically active, but it has been unable to develop fast enough. That kind of a general statement, but give facts like per capita income, like hospital bed per 100,000 population, that kind of social and economic and educational indicators, not a narrative. Chronic political instability and erratic economic management, not needed. That's not needed. Why? Because they want to know the justification of the project. It's the rationale of the proposed grant project. So it's not the political history and geographic distribution of districts are not relevant for the project. It's only relevant to the project. You give the rationale here, okay? Problem analysis. So now you are saying eastern region of Uganda is comprised of 32 districts, 9 million residents, only a few health centers. When you say a few, give numbers of health centers and hospital beds, number of doctors. That would give out for 9 million people, how many doctors and how many health centers are available. That would give clear indication. Okay. It says that government hospitals being 30 kilometers and health center IV facility required to serve more than 50,000 people. So health center, so it's 30 kilometers away, 50,000 people. These are important numbers, okay? And health center is not sufficient. You should say how many health professionals are there, doctors and pharmacists and nurses. These are the main health professionals. So then one can compare how many actual number of people to serve how many number of people. So 50,000, is it total number of health professionals 50? That means 1,000 per health professional. Then you give, even out of 50 health professionals, there are only 5 doctors. So that means 10,000 people per doctor, or 1 doctor for every 10,000 people. So that's too much. People will be much, there will be more need for doctors. So this is in UK, a developed country where education is free, health is free. Here we have 1 doctor for around 2,000 people. So that would be a kind of reference point for you. Okay, number of factors put population in large communities at risk of poor health. This is general comment. You should say about only the target population, because problem analysis is not the whole country problem. You cannot solve the whole country problem. It's not your job anyway. So you need to say who you want to serve, why they need your service, and how many people are they, and what are their socioeconomic conditions. Can you see? These are important details that pinpoints, connects to the project, and that it should connect to the purpose of the funding body. So a lot of things we say, they are beneficial, but not core relevant points. Okay. So remote dwellers in these areas have also traditionally been isolated from the rest of the country, placing them at the bottom of the so you can say all these, you can say because of remote areas, distance of health service professionals, so many people suffer. And if you have any specific data about what kind of health problems they are suffering, that would be beneficial. That would be beneficial. Okay. So you can say how many people are suffering from chronic disease, how many people are suffering from what disease, cholera, malaria, typhoid, whatever it is. You can say they suffer from these, and give some image or give some numbers let's say out of 50,000 people, 10,000 are very sick and with no treatment available for them, no service, health service for them. So that kind of a pinpointed image, okay? Because if we say a lot, but not relevant to the funding body, then it's not important. And it actually, a lot of writing that means they have to do a lot of reading that requires that time. So just bullet point and hit where it's needed. So there are perennial challenges facing Uganda health system. So you don't focus on a Uganda health system as a country, you say health system in the location you are targeting. Can you see? From macro whole country to micro where you want to hit and do some service. You are not dealing with the whole health system of Uganda. You can say because of health system, this locality suffers from X, Y, and Z. This location requires A, B, and C. Can you see? So it's very absence of drugs, poor pay for health workers. Try to cut down on the narrative and make it more specific. What I would say, please redo the same applicants and new applicants, learn from what I'm saying and redo. But the Yusuf, next month we will do the same, so that they actually have built on the knowledge and understanding I'm giving, and they do it accordingly, and that would develop their skills. So please, everyone write down notes. Main rationale for Opec fund support. Good health and well-being for everyone of the 17 sustainable goals. This is not good, because you want to give why OPEC funds should support. SDG is only a reference point. Good health and well-being for everyone is not your responsibility. You should say that this is my target population because they don't have this service, and you want to develop their good health so that they can be economically productive. They can take care of their own families, and they are not dependent on others. And it will remove, they will upgrade themselves from poverty. These are more relevant. When you say good health and well-being for everyone, it's not really, it is needed, but it's not relevant for OPEC fund support, because we are only asking for 5,000. Okay, 5,000, not 5,000 here. How much you are asking? Let me see. You have not mentioned it here. Okay, it will come. So let me go to project status. Volunteer health workers. I'm not going to go through the full write-up, but I'm going to pick on some, some tips for you. So project status is the volunteer health workers are ready and available when called upon. How many do you have volunteer health workers? That's an important. Uganda Medical and Dental Practitioners Council already provided us with license to carry out. Now, this is the important point you are making, that you are licensed from relevant authority to provide medical camps in parts. So simply say medical camps in any part within jurisdiction is implied. When you are licensed, you can do in any part, it's understood. So cut down on as many words as possible so that the funding body doesn't have to read a lot. Our partners from Medical Hub, Kampala, Masters Medical Center, Hepatitis and AIDS organizations, and Makerere University Medical School pledged to provide us with volunteer health workers. So what you can say that our 5 partners, okay, health centers and Makerere University. You know, Makerere University is, shall we say, top in East Africa and one of the top in whole of Africa. It's well known. When I was university student in the 70s, I heard of this name. So it's quite, so this is good to mention that Makerere University is our partner, okay? And they will provide help. So status is your preparation and your offers. So project is ready for implementation. So this is good, unlike the other one that I read. Project description: provide free and high quality medical service to the poor population of Eastern Uganda. Give numbers, give how many districts you are targeting, something that you are able to do, not you are just promising here and you can't do. Don't promise something you can't do. Then the funding body will take a wrong image. Conduct mass disease prevention and education for all 32 districts of Eastern Uganda. Now, if Dr. Anule, are you able to do that? 32 districts?
Yes, according to our plan, we think we can.
You have the human resources to do it if the funding is available?
Yes, we can.
Okay, that's good. I just wanted to check. And then this is good. You are saying screening, malaria and things like that. You can do. This is very good. You actually pinpoint. This is very good. So first one should say, first one and second one are, I guess, the same. Give the number of people involved. So combine the two and number of people involved. Okay. Curative healthcare, prescribe and dispense medicines. Okay. Integrate patients into existing social services and healthcare systems through referrals. Is it government system or your, I assume it is government system. You can say not existing government social services and healthcare systems. That would be clearer. Provide psychosocial support for adolescent girls and boys and inform them about their reproductive and sexual health. Register. So it's actually, you are giving them awareness, not inform, just inform is, awareness is to make sure they understand it. So it's awareness, to give them awareness about this part of health. Okay, register rare and severe cases and refer to specialized centers. You can say if you have a relationship with specialized centers and how many specialized centers are within your reach. If you mention those specifics, it would be good. Evaluate living conditions of the target communities and determine the obstacle and challenges to work on solving their problems. I assume this thing you would have done before you applied for the project. So that, but you are saying economic living conditions, primarily economic conditions, so that it takes care of others. So you can say economic conditions, which is actually living condition. Promote health literacy, healthier lifestyles and general well-being. Again, your target numbers, how many people you are targeting, how many people you are made. So 32 districts. If you haven't mentioned the names, you can just mention 32 districts here. Project main activities planning, knowledge of health statistics, permission from relevant authority, I guess it's just one. Camp information dissemination. These are the steps, core activities. This is good. This is good. And here, first one medical camp will be conducted every 12 weeks. Here, two numbers are required. One number is given in terms of 12 months every week means 52 times. So one medical camp will be conducted every week. So 52 weeks, you can say, for 12 months, it's also clear. But how many people will be actually delivering the service and how many people will be receiving the service? Those two numbers are required. Very important. so that it's very clear what you're delivering, how far it is. Okay, 4 medical camps will be conducted every month, and a total of 48 camps and 12 months. Again, target population would be particularly needed here. Minimum 5 volunteers will attend every camp. Okay, so you start off with how many people are involved in providing service, and then how many people are expected to receive the service. Okay, each volunteer will be afforded 1 lunch meal a day. So you can say that the volunteers, all volunteers will have their needs met, meaning their living cost of during the service period. Essential medicines. Okay, every person attending the camp will be seen by a health worker. This is understood. So when you say medical camp, every person you will see, you can combine these two. 250 people will be seen by doctor at every camp. Now, this is something you can combine with when you say conducted every week for 12 months. Now say serving 250 people per week. Okay, so conducted every week, serving 250 people each time. So it's combined so that you don't need, okay, motor van procurement. This is good. This is good. Okay, Brother Anuli, you have Anuli Omar, you have this bullet point is always liked by them. Project inputs. These are the steps, what you will do one after another. It's a sequence of actions. And these are inputs, materials that you need for it, for the service to be provided. This is also good. Bullet points. Impact. Health literacy will increase in the region. Again, number of people, more than 13,000 people will access quality health care. So, and education will probably be a lot more. So give numbers. Health literacy will increase. Instead of in the region, you can say in the region, in the target, among so many in the target population. So mortality and preventable disease will be reduced, but give an estimate of what your intervention will help in terms of maternity, health, and preventable disease will be reduced for so many women, if it is women related only. 13,000 people will access quality health care. Okay, so that's the number you're talking about. So you start off with that they will have health, quality health care. If it is, I guess literacy will mean a lot more people, maybe 50,000. So give numbers there. More than 100,000 people will benefit indirectly from the services and information disseminated. Now, when you say indirectly, explain it. 130,000 people of the 13,000 who will have access to healthcare, their families and friends will benefit. So this is how you connect. Children, women, adults, and elderly. Awareness of personal health, hygiene, and sanitation. So you can say you will provide leaflet, maybe audio, even video CDs. Okay. Now here is the 28,000 purchase of a motor van. I think don't ask for it now. First time round, you can say, because you are planning for 52 weeks, you will need that. Okay, yeah, you keep that. Then cut down elsewhere. Maybe if it is $15,000 new, maybe you buy secondhand and make it much less. Let's say purchase of used motor van. Is used motor van $15,000 in Uganda?
Yeah, it's quite expensive in Uganda.
That's
It's actually, this is the lowest almost.
I mean, in UK, it will be less. Amazing. Used
It's
motor.
the taxes in here,
Uganda is more expensive than London.
in
What an
terms of
amazing-
taxes.
Anyway, what you can do is instead of asking 28,000, you ask them for 15,000 for the vehicle and say we will mobilize funds from other sources, the rest of them. Okay, so this way they will see that you are not entirely dependent on them. Because it's first time, it's good to that justification. As I said, it's the benefits and the cost of not having the project. What are the consequences would be a justification. Strategy. Okay. Just highlight the major parts. Too much writing can actually put them off. So just highlight the main parts that you want to do. Bullet point is good. Implementation elements, again, just highlight the main parts. So you can core business, core components, the details, you can say there are other arrangements we have made. So just make it as a catch-all statement at the end. Like you are saying, project accountant will make sure there is a value for money. So you can say more specific here that we would, who will do the value for money? You can say the value for money, we would like, we have arrangements for a professional to look at value for money. So cut down on how much you can do. Sustainability. This is an important issue for all funding bodies. How would you continue after the funding is finished? So you need to have an income component. Whatever the form it is, you can say government funding, you can say, you know, the philanthropist funding, local, national, regional, international, all kinds of things. For your information, I have a book. I have subscribed to a site where I receive funding every week, at least 2 announcements of who are offering funding. But also I have a book, more than 1,000 pages of international donors. So if anyone has a good application form prepared, this is their prize, they will get it. Because then you can apply. So risks and mitigation measures. What are the risks and how would you face the risk? Mitigation means how one is risk prevention, the other is risk mitigation. Prevention is it doesn't happen. Mitigation is when it happens, what will you do? What measures do you have in place? Knowledge management and visibility. You need to spread the knowledge so that they learn about taking care of their own health. Result-based logical framework. Logical framework, I don't know whether you understand. Input, output, outcome, and impact. So input, all the efforts and all the materials. Output is how many people you are serving. So you have input, output, outcome is consequent to the healthcare you have provided. People are more able to earn their income. They are fit. They contribute instead of burdening the health service. They contribute to the economy. Impact is economic growth, in income generation, business activity, economic engagement of people will increase. So those are the 4 components of logical framework: input, output, outcome, impact. Let me explain. Input is materials and human beings needed, funding needed, all these things needed for the service to run. Output is how many people you have served. Outcome is what benefit they get because their health is good. Impact is what is the consequence of their contribution to the society, socioeconomic contribution. So that's the impact. What they do is outcome. They have received your service is output. Outcome is when they do something, and impact is the consequence or result of their action. So these are the four components. Implementation plan, this is this is called Gantt chart. So this is well done, Gantt chart. Okay. I have to take this. Okay. Okay. So routine monitoring will be carried out. Okay. Progress report, reporting. So it's actually the arrangements you have made, detailed project budget cost. Here you give more details, and that's it. So do you have any questions on this? This is actually all the applications so far in the webinar, 2 webinars that I run. This is the best application. I have just suggested some refinements and cut down of words and simplified, but otherwise this is the best application I have seen over the last 6 months. Okay, so grade A to Dr. Anule Omar, you have you been making applications in the past?
Not exactly. We haven't been applying so many organizations before, but
you have done as if you are quite experienced in preparing, but it's a little more detailed than funding body would require. Dr. Ayrat Sulaiman, please ask.
None. I want to just ask you to kindly go through the output, input, outcome, and impact.
Very good, very good. Okay. Input is our effort, our materials, our volunteers, all these to provide the service, what you need, those are input. Okay. And funding, all those are inputs. Things that you need to come together to be able to deliver the project. This is called input. Output is when you have delivered something to people, that's output. What you have done is output. When the people you have treated or helped, when they do something is outcome. So what you do with them is output. What they do with others is outcome. The result of what they do on the other people is impact. Again, all the time, material, people, money, equipment that you need to deliver this service is input. What you do to people who are in need, or the health need or education need or whatever need, is output. So you are putting it out. Okay. Input is what you need to start the service. Output is when you are putting it out to benefit others. Okay. Outcome is when these benefited people do something good for their family, for their society, for their organization, whatever it is. This is outcome. Outcome is not what you do. Output is what you do because you are providing the service. When they do something, not you, when they do something, that's outcome. Result of what they do is impact. Like you have helped recover health, and then they do and work, so they contribute to the economy. They bring income and benefit the family. So the impact is the family is eating, family is living. Can you see the connection? Any other question? This is a good question that you asked, Professor.
Thank you very much.
Yeah, this is
important
to understand the logical framework. It's called logical framework, or for short, it's called log frame. Professionally, it's called log frame. That means logical framework, meaning input, output, outcome, impact. Okay. And they are all connected. You see, without the input, you cannot help them. Without that help, they cannot do something to others. And without that doing others, the impact is not there. Okay, let me, I think, no, I can't take that. Okay. So, okay, brother Lutamanguzi Emma, please ask, what do you want to ask?
Assalamualaikum warahmatullahi wabarakatuh.
Walaikum salam wa rahmatullah.
My question is just one. I would want you to throw some light on monitoring and evaluation.
Okay.
Lutamaguzi Emmanuel from Triha Charity.
Okay. Monitoring is checking that you are doing it according to plan. That's called monitoring. Just checking during the action. Evaluation is end of action. What has it achieved? And evaluation is always according to what was the plan and what was achieved, comparing the two. Monitoring is it going according to plan? Checking. Monitoring is checking during actual action. And evaluation is checking the result of the action, end of the action, and what was intended and what was achieved, comparing the two. Can you understand the concept of it? So, for example, if you are doing, let's say, one health camp, this is one project. So the 52, it can be described, the earlier 152 projects that we saw, it can be called 52 projects or one project with 52 actions. Okay, it depends on how you want to look at it. So you have to say that all the numbers, you see, justification is given. So you need to think, when you prepare something, think like a funding body. So read it, what you have prepared, read it like you are the provider of funding. Okay, and then you will feel the gaps. A number of gaps I have identified, even though it's very well prepared. As I said, among all these trainings I have done, this is the best application I've seen. Yet it has, it needs to cut down because, you know, funding bodies. Let me give you a concrete example. When I was in London in government service, in 1985, I was distributing £2.5 million in 1985, which is in today's terms, 11-12 million pounds. Huge money. So then they would, there are some projects we maintain every year because there are salaried staff we pay. Okay. And we had certain rules. There are 30 standards that we have prepared, like democratic standards, economic management standards, equal opportunity standards, good employer practice standards. So we had those lists. So we can deal with it another time. So for projects and for applications, you need to think through and be pinpointed. If I have missed any part of your question, please repeat. Brother Edward, assalamu alaikum, long time. Brother Edward, I have not seen you. Alhamdulillah, nice to see you. Brother Edward is from Philippines. He's a good friend from long time ago. I was doing a training course in Malaysia. So, okay, Brother Lutamanguzi, do you have, did I cover it enough or any gap I have left? Please ask.
No, you actually covered it. You covered
it. Monitoring evaluation. Okay, anybody else wants to ask questions? I want all of you, Brother Yusuf will provide the application form and the guidance from the funding body. This is from Vienna, Austria. Please redo the application. Those who have done, those who have not done, I hope you have made notes. You do it, and I will evaluate it just the way I did today, so that it is ready for submission. Okay, this way you can actually, Brother Firoz.
Yes,
I
assalamu
couldn't get
alaikum.
you, but you
Assalamu
got the
alaikum, brother.
Walaikum salam wa rahmatullah.
Okay,
So
actually, I done late because I was confused. That's why I could not fill up the application. Now today I fill up it. I send you to WhatsApp only, but I don't have email. That's why I could not send you email. So if it's late,
okay, what you do,
it is now
Brother
in your
Firoz,
WhatsApp. Yeah.
Brother Firoz, what you do is you send it WhatsApp to the group. I don't know whether Brother Firoz is added, Brother Yusuf can add. Brother Firoz, you give your number in the chat box. Brother Yusuf will add you. So what you do, take note of the advice I have given and refine your application. Refine your application and then send it to the group, and where Brother Yusuf will get it and I will get it at the same time. Okay, Brother Firoz. And Brother Suleiman, you want to ask any question? Okay.
Sir, I have a question that have any
Yes,
guideline or
Doctor.
deadline to submission the application? Have any deadline yet?
They have not announced any deadline. So like Islamic Development Bank where I worked, we didn't have any deadline. So all the year, but it is better to apply early. It is better to apply early, so that in Islamic Development Bank, we used to have open deadline, because all the year round, because if it is a deadline for Islamic Development Bank, they had a justification. Let me explain why there was no deadline. Because all the year round means the work is spread out over 12 months. If you say deadline, all the applications, hundreds of applications, that means all these hundreds have to be read, evaluated. So what we did was every 2 months, we had a funding body, a decision-making body meeting. And whatever applications came, that was considered then.
Thank you.
Not all money was spent in one go. So let me see, Dr. Anule wants to, Dr. Said Shahid, you have any more questions?
No, sir. Shukriya. Shukriya.
Thank you very much.
I have
Professor Airat, Professor Airat, any question?
Yes,
And
yes,
after that,
you-
Dr. Anule will come.
So for me, I don't have the application.
Application form.
Yeah.
Okay, I will send you application form.
Oh, okay. Okay. Thank you.
Okay. Brother Yusuf will give in the group so you can see the application. He did already.
I
It should
don't
be
think
there.
I'm in the group. I don't think I am in the group.
Okay. Okay, I can also add. Brother Yusuf can add. We're both admins. So I have Professor Airat Suleiman's number. I will add you, but I will need you to have Telegram app downloaded.
Yes,
So
I
all
have
of you,
Telegram.
please download Telegram. Okay, so
I am on
I can
I
add
am
you
on
today.
Telegram.
Inshallah.
Kita Telegram.
Great.
Oh, no.
Brother Edward,
Yes,
you can also
yeah.
have Telegram downloaded, all of you. Okay.
Yeah. Yes,
Okay,
yes.
so
Yes.
so I will add Professor Airat Suleiman and Brother Edward Lim. I will add
Yes.
both
I
of
am
you.
already on
Dr.
WhatsApp. I
Anule,
am
you wanted to
already
say
on-
something?
I am on
Now,
Telegram.
now,
Yeah, okay. Yes, Dr.
I have
Anule.
two issues.
Anule,
One,
what?
we, the Ugandan group, we are not in the
Going on your
WhatsApp or
account
the
yet.
Telegram group.
Telegram.
Okay, what
And
you
then,
do, give your number here, Brother Yusuf will add you. Do you have Telegram app, Dr. Anule?
yes, we have Telegram. And the second issue,
Okay.
from the last webinar, you mentioned that you had over 1,000 pages of possible donors, and you said you will share so that we find
Yeah,
out which ones respond.
1,114 to be exact.
So you said you will share and find out which ones actually respond and which ones don't respond. I don't know when shall we follow up on that.
Okay, did I give you that book?
No, Sheikh, no, you didn't. You did not share.
So just remind me by WhatsApp, and I will send you by email. I can also send you by WhatsApp. What I will do, you can get your team to write to selected organizations and see and give me a report which one is more responsive and efficient, so that we only recommend those to the people. So you can help everybody like that. So inshallah, like that. Okay, we are coming towards the end of the time. Brother Edward, you have anything to say?
Sir, request you to meet with you again.
Inshallah, inshallah. Dr. Said Shahid, it will be my pleasure. Just give me enough notice, because
It's our pleasure.
even though I'm retired and not tired, I'm too busy with many things, but I will create space, inshallah.
Thank you very much.
Okay, Brother Edward wanted to say something, I think. Is your microphone working?
I will try to access the application form, because I need a lot of support for the school we are putting here in education. So thank you so much, Brother Mamoon. Thank you so much for inviting me to this webinar. Assalamu alaikum.
Wa alaikum salam wa rahmatullah. Jazakallah khair. It's my pleasure. Just connecting with Dr. Putri could not join, but you could join. So,
brother, I have given my number. Brother, I have given my number to chat box, so everybody can get my number and they can add me in WhatsApp. Then they will get me in WhatsApp, inshallah. Then I can get my form.
Okay, I can't see your number, but the Ibrahim, there is a number from Brother Lutakome. Okay.
I am Firoz, given my number to chat box. Then WhatsApp, anybody can add me, then they will get me in WhatsApp.
Anyway, I will add you to the group, inshallah, because I have your number. Okay, Brother Yusuf, back to you, because it's almost 1.5 hours. So inshallah, please, everyone do the form again. And Dr. Anuli, please refine it, cut down on words, and just focus on not the full detail, but the key details, and say you have more details. If necessary, the funding body can ask and you can give. Okay, that way. So back to Brother Yusuf in Hong Kong.
Okay, Jazakallah khair, Ustadz Mamoon. Really, this is a very fruitful discussion, and I hope all the brothers who joined us today learned a lot from the skills, the technique, also how to prepare a good application. Inshallah, we will continue with such exercise in the coming session. So without you, maybe we would end the program here. Subhanaka Allahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayka. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Wal asr. Inna insana lafi khusr. Inna alladhina amanu wa amilus solihat wa tawassaw bil haqq wa tawassaw bis sabr. Thank you so much, Ustadz Mamoon, for your enlightenment and also the participation of all the brothers and sisters. Inshallah, see you next time.
Next time is next second Sunday,
yes.
Same time, second
Yes.
Sunday of the month.
Yes, inshallah.
Assalamu alaikum.
Walaikum salam. Thank you so much.